you today about mental health and wellness in pregnancy. Pregnancy can be an exciting journey that is filled with many emotions. Although there are many exciting moments in pregnancy, hormonal changes can affect your mood, and it is important to get the right help if you feel you are struggling. Growing a child is an important job that can be mentally and physically exhausting. It's important to take time for yourself and check in with yourself from time to time and ask yourself, how am I doing? What is causing me stress? And what can I do to reduce my stress? Checking in with ourselves regularly allows us to recognize our symptoms and to know when to report them. There are so many tools used in healthcare to evaluate depression and/or anxiety that may be useful for you if you are concerned about your mental health and are not sure when to speak to a professional. So the first tool that I wanted to show is to screen for depression. Each statement is meant to be evaluated by you on a scale of 0 to 3, depending on how you relate to each statement. The questionnaire evaluates how much you relate to the statements. The statements in this questionnaire are as follows. Number 1, little interest or pleasure in doing things, rated on the scale as 0, not at all, 1, several days, 2, more than half the days, 3, nearly every day. Number 2, feeling down, depressed, or hopeless. Number 3, trouble falling or staying asleep or sleeping too much. Number 4, feeling tired or having little energy. Number 5, poor appetite or overeating. Number 6, feeling bad about yourself or that you are a failure or have let yourself or your family down. Number 7, trouble concentrating on things such as reading the newspaper or watching television. Number 8, moving or speaking so slowly that other people could have noticed. Or the opposite, being so fidgety or restless that you have been moving around a lot more than usual. Number 9, thoughts that you would be better off dead or of hurting yourself in some way. The next chart we'll look at is screening for anxiety. The evaluation works the same way as the previous screening, with the numeric scale from 0 to 3 and the self-evaluation of how you feel you relate to each of these statements. The statements on this questionnaire are as follows. Over the last 2 weeks, how often have you been bothered by the following problems? Number 1, feeling anxious, nervous, or on edge. Number 2, not being able to stop or control worrying. Number 3, worrying too much about different things. Number 4, trouble relaxing. Number 5, being so restless that it's hard to sit still. Number 6, becoming easily annoyed or irritable. Number 7, feeling afraid as if something awful might happen. These tools should not be used to self-diagnose, but may be helpful in helping you decide when an appropriate time would be to seek help. A mental health professional may use different tools for evaluation, and together you can talk about a treatment plan. Now I want to talk about some things that you can do to manage your stress. Some tips for improving mental health include speaking with trusted family members, friends, or care providers about your symptoms. Deep breathing exercises, exercise or physical activity, rest, healthy diet, listening to music, meditation, reading, and coloring are just a few suggestions that can reduce anxiety and enhance mood. Picking favorite activities to do when you are feeling sad or anxious can promote better mental wellness. There are so many options of things you can do to reduce stress and elevate your mood. Choose something that makes you happy and is healthy for pregnancy. If you feel that you are still struggling with your mental health, even after taking time for self-care, never be afraid to speak with a mental health professional and seek counsel. Sometimes medication is needed to treat these symptoms. A doctor will be able to help you find a medication that is safest for pregnancy or breastfeeding at the lowest dose that is still effective. It is important to know that you have resources and support during your pregnancy journey. It's not uncommon to have depression and anxiety while pregnant. Many women struggle even after pregnancy during the postpartum period. While it's not an expected part of the postpartum recovery period, it is common and there is help available. Always remember that you are important and valuable. So take care of yourself mentally and physically so you can be the best version of yourself for you and for your baby.